Hello. Oh, hello. Hope this is It's been a few weeks since I did a little video, so I thought I would check back in. I am now 30 weeks pregnant, well into the third trimester. I can't actually remember where I was in the last video now, it's been like so long. Here's Bump cooking away. Apparently the size of a cabbage. Must be quite a big cabbage, but there we go. What comes with having such a huge bump is like everything gets compressed. So I'm having like constant indigestion, found myself getting a bit more breathless. Like I used to be like the fastest walker out there, in the streets, and you're like, get out of my way, like always overtaking everyone. Now I am the one I notice, and I think I'm going quite quick. I'm like, yeah, go on, girl, up the hill, St. Michael's Hill to uni. And then people are just like, people are like, out the way, bitch. And I'm like, I'm pregnant. But yeah, it's been okay. So we've been back at like school. So I've been at a hospital in Bristol so we're in like an academy. So we do like some school teaching, and then we go and apply our learning in the wards. So what we've been doing is taking histories, like medical histories. So when a patient comes in, obviously you're finding out what they've come in for. When did the symptoms begin? Have they got better, worse? Was it following any incidents? Is there anything that makes it better or worse? So yeah, all different symptoms, and then doing like a physical exam on them. Nothing invasive, so no kind of taking bloods, things like that. I am just second year medical school, just started. So yeah, stuff like listening to heart rates, looking at things, kind of visual clues like capillary refill times. You'll like press a finger, or looking at just their general like pallor, like skin color, not skin color, but like if they're looking a bit yellow or like red or pale, things like that. And yeah, just little signs like that. But I think it's really good to get that experience early on of working in clinics and seeing patients and getting the confidence to go and chat to them and find out a bit more. And it's really fun as well. It's really nice to hear people's stories. And I think they appreciate as well, because obviously we're quite stretched in the NHS, and they don't usually get that time to chat to people and really feel as heard. Whereas as a medical student, you've just got time. We're learning, and so we have that time to listen to a bit more about their history and their social situation. Do they live alone? Do they have a partner? Had a lady the other day with 6 kids and talking about all her life and things. So it's nice to have that time, I think, as I say, for ourselves and for the patient. Obviously it's just us practicing, so it's nothing that kind of gets taken forward. Like our notes and our examinations are not what will then be used as their kind of like profile, I guess. Like it won't be kind of like, oh, this girl says that they've got a irregular heartbeat, so we'll assume it's this. It would be, professionals would check it, is what I'm trying to say. It's just practice for us, but very good practice, I think. What else has been going on? I've actually been a bit unwell. Having said that, I feel a lot better today, although I have found it's kind of ebbed and dipped. I actually did do a COVID test, because it's been kind of cold, flu-y, persistent cough, and just generally feeling rubbish. Apparently you feel worse as well being pregnant, like illnesses can feel a bit worse. I think your immune system's a little bit more suppressed, perhaps. So yeah, I've been feeling a bit rough. And as I say, sleep when you're pregnant, especially this pregnant, you have to like side lie, otherwise you'll compress your vena cava, which can affect your circulation. You could pass out. It's restricted blood flow to the baby. So side lying, I find it can be okay, but like it started to hurt my hips sometimes. So I'll wake up uncomfortable because my hips hurt. I'll wake up with like crazy indigestion. Now, as well as that, I'm waking up because I can't breathe or because I am coughing. So it's been quite a struggle. And I don't like to make excuses, but I think that's why I've been a bit delayed in like making videos. I'm just trying to keep on top of everything school wise, which, by the way, I don't think I have been. I've got an essay to write in the next couple of weeks, and I've written like 100 words. So I should probably get to that, but we will. So yeah, been a little bit unwell. I also, because I was feeling so tired. So first trimester, you are really tired. Second was all really nice. And then this third one, I was like, why am I so shattered? And I just put it down to I'm pregnant. Like, I guess this is what happens. But then I had like my full bloods done as part of routine things. And it turns out my iron was super low. They gave me these pills, and so I was taking them again. But then I realised why I had stopped taking them in the first place. So they were ferrous fumarate, and people can be very quite sensitive to iron because you think of iron levels, and if you have lots of iron, you'd think, oh yeah, I feel really energized. But in actual fact, it was making me feel like severely hungover, to be honest. And I've had a 1 or 2 severe hangovers in my time, so I know what I'm talking about. But yeah, I just felt horrendous to the point that I thought I might be actually sick. But like really bad headache, absolutely wiped out, sleeping. And I just thought, I've just started back school. I can't really cope with feeling like this. So I stopped taking them again, but then obviously now I found out that my iron is so low. So they've given me a different form of iron. So it's ferrous sulfate, which seems to be okay for me. So yeah, I haven't had any adverse symptoms with that. So that's been good. Carry on with those. Why not? I've also been reading this book on hypnobirthing. I think I've mentioned this a couple of times. But it's been really interesting. So it's a lot about how you're breathing and kind of language used to describe like contractions or surges and different ways you can kind of naturally produce oxytocin, which is the feel good, happy chemical in your body, like naturally. So things like your partner doing certain massage techniques, and just being comfortable in your environment. You might want like lower lighting, you might want certain music playing, or some people have affirmations or guided meditations. I think I'm just going to make like a playlist. I'm not sure what. I don't know if I should go for chilled or like distracting and happy. I don't, maybe a mixture. But yeah, and as well, it's kind of, I was just thinking I'll just have her in hospital, but reading a bit more about it, I think, and in St Michael's, I'm lucky, it's literally like 5 minutes up the road. And also they have like a birthing centre rather than, or clinic, centre or clinic, which is like within the hospital, but it's a bit more kind of a chilled environment, and it's kind of midwife led. But then if there were any complications, if I suddenly needed a C-section or whatever, or demanded an epidural, like more pain relief or whatever, I would be able to literally go next door and get these things. So the help is on hand, but it's a bit more of a chilled, they have all the birthing pools, which I'm hoping to go for the birthing pool. One thing I will say though about hypnobirthing, so I've gone from being like, oh my God, I'm terrified that I have to give birth. Because of how it's portrayed in films, people are getting rushed down the corridors, they're screaming and, then, oh, she's losing blood and, it's all very like scary and traumatizing. So I've gone from having this kind of, oh, that's terrifying, to reading this book. And now I'm like, oh my gosh, I'll just like breathe it out. So I think I need to like not be so complacent, but I think going in, not in a place of fear, is probably good, beneficial. So it's good, but I'm also like just reminding myself like it will hurt. Like I know the book can say, oh, it's, you hear these different stories in there, birthing stories, and it all sounds very lovely. But yeah, not to be fooled by the fact that it is going to be an intense experience. Intense but magical, I hope. And I really hope, I know everyone probably does, like you can't say what's going to happen on the day, but I hope that I am able to have her like naturally, like push her out or breathe her out. Because I just think it'd be a cool experience. And a friend of mine, she's like, you get the biggest high afterwards, like, and I've heard that as well in the book, like you're on this like high and bonding with the baby. And so yeah, it would be nice, it would be ideal, but obviously, these things kind of do what they like, don't they? You can't, I think people have all these plans, you can put all these plans in place, but it won't necessarily, sadly, happen. But we can but try. And stuff like someone was saying about knowing what pain relief you would want to go for and when. So yeah, I just think I need to be a bit more organized and a bit more clear in my wants and needs when it comes to the big day. So yeah, so that's a little bit about pregnancy at the moment, how it's all going, little update on school. So we're literally in hospitals. So we've had our student choice project, which I need to write my essay on, media and medicine. And then, these 3 weeks in the hospital. Then we have a week off, within which I'm going to have my baby shower. So I'll get some photos and things of that. And then we're back in with like proper lectures and stuff. And then before you know it, I will be giving birth. I have a little feeling that she might be early. I don't know why, but she's just very like mobile. I just feel like she's keen to like get into life. She's like flipping around, arms and legs, like, yeah, I don't know. I can see her maybe coming early. I think because my mum as well had my older brother, her firstborn, 2 weeks early. So I don't know. Early would be nice as well. She'd be a bit smaller. But here we are. I've also been thinking a lot about what I'm going to do school-wise when she does arrive. So I've been looking through my timetables because we have all our lectures, but they're also online. And attendance-wise, obviously you should, if you can, like you're paying for uni, go to your lectures, go to everything you can, soak it all up, be at school if you're at school. But for me, with a newborn, I've looked at stuff that I actually definitely need to be at. It's like attendance wise and learning wise, like these are smaller group things that we have to be at. Stuff like doing work in the labs and having our like tutorials and case-based learning. So I've actually, and like any exams along the way. So I've actually gone through my whole timetable for the rest of the year from January. So obviously I'm having her some point in December, maybe late November, who knows. And then, we're back in again from the 5th of January. So I just had a little look at what was around. So this is quite a busy month, January, actually. I don't know if you got my ring light, but yeah, every week. So the most you'll have is like maybe 10 hours in a week contact time. And that's not all in one go. That's like, I go to case-based learning 3:30 till 5, and that's literally up the road from me. So I'd have to be gone a couple of hours. So I think it's kind of manageable. And that's the same for like a lot of this stuff. So I'd only ever be out at like a couple of hours. Also, Jack's work's quite flexible, so he could maybe cover when I'm not here. I also have a lot of like girl mates and things around who I might be like, yo, can you be here with my baby for a couple of hours whilst I go to school? I think the main kind of thing that will be something to consider and an issue would be energy levels. Am I going to have the energy to, because I will have to obviously go over all the lectures and all the content. So it would just take a lot of organization and planning and like drive, I think, if I was to continue. I definitely went through a time of being like, no, I'll take a year out from December until the next December. So I'll miss the last 2 semesters of school, and just mum, which sounds nice, but I'm also like, I feel like I could do it. So I'm very much like toying up with that. So I wonder if anyone has any advice on that. What would you suggest? Have you had a baby? Did you continue to work? Are you studying and have a baby? I posted something the other day, and a girl who I have on my Instagram, she was like, "Oh my gosh, I'm having a baby," and she was literally just starting med school. So she had her baby, I think, like a week before starting med school. So I have to check in with her, see how she's doing, because I'm sure that's quite a lot, isn't it? Well, no more than I intend to be doing. So yeah, just a little update. I'll try and be a bit more consistent. I think before I was like new videos every Sunday. I think that's probably not going to be the case, just with everything going on. But I'll try and post as often as I can. For your sake, as if people care, but like for myself as well, I like to have a little diary of this. I think it's quite cool. Be nice to look back on. So yeah, I'll leave it there for now. Thank you for watching, and yeah, stay tuned. Not long to go. She's cooking nicely, hopefully. So yeah, we'll see. Speak soon. Bye.